yes, I have my back pain.
Mm-hmm.
I have like a nervous. It's coming hurt me a lot for my head,
Mm-hmm.
and I have sweating a lot in my hand. Sometimes it's red, it's cold, or it's
Show to the viewers. It's already changing as we speak.
yeah.
It was like all pure blanche white, and then now it's like turning to dark red so quickly.
It's dark, and I'm coming like sweating. If you see me, I'm sweating right now.
Okay.
So sometimes I can't speak good with the customers or family or people because it's everything changed. If you see, now
Mm-hmm.
it changed.
I see that.
Yeah.
Okay. And also, it's just started to. Yeah, there you go. So we can see in the viewers right now. There's a lot of twitching in the face right now, but mostly on the left side, but some on the right side as well.
A little bit to the side.
Mm-hmm. All right, so there's clearly something going on wrong with that facial nerve over there.
Mm-hmm.
So it looks like talking. It seems to activate the facial nerve, and there's like a reflex, and it goes right into all the facial muscles themselves. So that's what's triggering it. So there's some kind of irritation to that facial nerve. We're gonna get right to it. There it is. Yeah, reading right there. Yeah, this one's very chronic. And there it is. It's one point to the left, very tiny. So what I want to see over here should be nice and smooth, but this is boggy over here, right? So that shows us that there is some swelling over here. And when we test this fellow over here, how's that?
Yeah.
Tender, right?
Yes.
So we see the whole entire body is already spasming and guarding, trying to protect this. And this fellow over here is also very stuck. Now here's a tip for the young students and the docs as well. When you deal with a petite patient, the edema is not as visible, so that's why we had the patient stand up. And we can see over here, the swelling over here is a lot more evident. And it's pulled all straight down to the bottom. So this has been here for quite some time. Okay, over here as well, we see just this nice little bulge over here. This section over here. So when we test it, right there, it's stuck. How's that? Pain, right?
Yes.
Yeah. So we're checking every structure, and right there, very tender, correct? This is the fourth cervical. So we already saw before, your left face, actually even on the right side, are all twitching. So what's going on with that, right? And especially with, you're talking about the hands get cold, they get hot, it's sweaty, right? So we're gonna piece two components together. Let's work on the facial part, right? So you notice that it activates when you're talking.
Yes.
So we're dealing with this fellow over here, facial nerve. The facial nerve itself, that's the muscle that's responsible for controlling the muscles in our mouth and the face as well. So when we talk, yes, you're sending some information to the muscles in your mouth, and it's also sending information back into the brain because it needs to tell it what the mouth muscles are doing, right? So however, there's some kind of short circuit going on over here, and that's what we tested for that fourth cervical. It's not functioning properly. So that's why with this relay that comes over here, it's not functioning properly. So to get to come from here to there, because there's that interrupt, when you talk, then what happens? There's a feedback loop going on. It's no different from, like, let's say, you accidentally like broke your finger, or you actually bang your finger. What happened? We jerk it back, right?
Yes.
So in your case, some kind of strange reason, your body's going, it's jerking, right? Until it starts calming down. So that's what's happening in your face over here. So we're gonna find we're gonna take a closer look on that fourth cervical over there, try to calm down this nerve. Other second component, we're talking about the hands. Why is it getting red or white or sweaty, right? So part of the deal with that is what we call hyperhidrosis. That means it's too much sweating. Now there's two major divisions of the nerve system that we're gonna take a look at. This is what we call the parasympathetic and sympathetics. Plain, simple language to understand is that this. The parasympathetic is like a brake pedal in the car, slows everything down. Sympathetic, gas pedal, speeds everything up. There's a division area. So typically, it usually ends around here. The brake pedal, over here and over here. I notice for those who have hyperhidrosis in the hands, sometimes it comes way down here. Okay, sometimes. Every person is going to be different because we're not wired the same way. Every single person is wired a little bit different. Right? So we clearly found the problem at that third dorsal over there. We're going to take a closer look, see what's going on, and see what we do to help you with these hands as well. The strategy with this case over here is this. We're to address the fifth lumbar, PLS, the third dorsal, PLS, and now we confirm the fourth cervical needs further correction as well. Why? It's because one component is this. The atlas, what we see over here, is rotated very anterior on the left side. Therefore, I'm looking for, is there anything spinous left? The fourth cervical is the first one that turns all to the left. That's part of the reason we need to correct it. Other reason why is because, as we see over here, there is a curvature over here. The third dorsal starts it over here. At the other tail end is this fourth cervical over here. And it's gapped open like this. So we need to close it up. Take the pressure off that nerve, get that facial nerve working again.
I don't feel too much pain in the back.
Good.
I feel like I can breathe more.
Good. So clue us in. What does the hands feel like now?
Looks good. It's not sweating anymore.
Good.
Or like my body doesn't feel hot anymore. Doesn't feel like I'm sweating. Nothing. If you see, like, now I can speak a little bit more.
Mm-hmm.
Before I can't.
You notice even your face and everything else felt sweaty. How's that now?
It's now more better than
Good.
it was before.
It's gonna go right there. I'm sorry, what?
Now it's not shaking anything my face. Yeah. Wow. Feels good. Wow. Yeah, it's not sweating. No, it's a little bit white, yeah, but it's not hot. It's not cold. You see, when I talk,
you still have a little fasciculation going on
not
there.
too much. I can feel it.
Now keep in mind, with petite patients, when you put them prone, it's not always easy to find the spinous contact where we want to do it. So the best way to do it, find it right here in the chair. Stand up. You follow them along to the high-low table. You lower it down, and you don't leave your finger off the contact point. So this ensures that we are exactly right on that fourth cervical, because we're about precision. Relax this over here. Again, you want to make the fine adjustments you want to the table to ensure the spine is in a neutral position before we correct the neck. Okay, just relax. Just let it relax. Right over here. Let it go. Let it go.
I feel like my head is like heavy. I feel like God. It's something different what I feel in my body. Something different. I can stand a little bit more straight. I don't know. I don't know how can I tell you, like, this feeling in my body. It's everything different. Now you can see I can talk with you. Before I can. Now I can see it's not shaking anymore, my face.
Well, what I see, very little microfasciculation going on. You have a little twitch right here in your lower eyelid over here. And a tiny bit right here is buccal. But everything else is significantly different from before.
Yes.
So it's going to take some time for your body to regenerate because you still have some swelling over here. So your homework is this. I want you to ice this over here 20 minutes 3 times a day. No heat. Okay? It has to be iced. You got to get the swelling out of the way. As the swelling calms down, you'll notice all that twitching start to get reduced and get better and better and better over time.
Oh, okay.
Right?
Okay. When you see me, I think it's on June. So after you do everything, so my hands, it's okay. It's not shaking anymore. I can speak a little bit more with my customers or people. Just a little bit. My like, it's like shaking. Then I have still pain a little bit right here. That's it. But I feel good.
Okay. But you also mentioned about it gets hot and cold.
Yeah, it's anymore.
No more.
No more.
Okay. What about the before you had the trembling of the face?
Oh, it's no more.
Gone, huh?
Yes, that's good because now I can feel like, when you are healthy and everything like that. So it's no more. If you can see, it's no more. The face is good. If you see, it's not like moving and everything like that.
Yeah, you used to tremble and do a lot of fasciculation on that left eye of yours.
Yes.
Yeah. And no more, huh?
Yes, it's no more. If you can see, it's no more.
How do you like that?
Yeah, I like that because before I came in you, so I feel like so, how I say, so nervous to speak with another people because I was like, that that was that day, so.
I remember. Okay, well, I'm glad you're enjoying it.
Yes, thank
Have
you.
a great one.
Yes, thank you.